So hi everyone, thank you for joining. My name's Syra, I'm one of the managers here. And today we're doing a webinar on preventing diabetes. So specifically for people who are at risk of developing diabetes. And we've got Rowena, our physician associate, who'll be running this webinar today. Just to give you a heads up, if we do have technical issues, please bear with us. We'll try and resolve them as soon as possible. And if you have any questions, feel free to use the chat box at the bottom of your screen, and we'll try and answer them towards the end. So without further ado, Rowena, I'll hand over to you.
Good afternoon, everyone. My name is Rowena. I'm a physician associate at Care Practice. Thank you so much for joining the webinar today. I will be talking about preventing diabetes, also known as high-risk diabetes or pre-diabetes. Syra, could we have the screen? Thank you. So, what is pre-diabetes? So it's when your blood sugar levels are higher than normal, but your blood sugar levels are not high enough for a diagnosis of type 2 diabetes, but you are at high risk of developing diabetes. This should really be taken as a warning sign. This can be completely reversed though. However, if it is ignored, there is a strong chance that in the next 3 to 5 years, you will become a diabetic. So what are the risk factors for pre-diabetes? One of the risk factors are if you have a really poor, unhealthy diet, if you are overweight or obese, if you have high blood pressure that is not very well controlled, if you have diabetes that runs in your family, and also if you have a really sedentary lifestyle and you don't do any sort of exercise at all. Also, certain ethnicities can make you have a high risk of developing diabetes, such as having an Asian ethnicity, and also if you're a male as well. So for testing for diabetes, in terms of testing, and if talking about numbers, we do a random blood test to check your sugar levels. Based on the numbers, you are classified as either low risk, which is the green area. High risk of diabetes is the amber, the middle area, or if you're diabetic, it's the red area. So the importance of controlling prediabetes, it's important to recognize that you are at high risk and you can develop diabetes, and one should take control of this. If you don't, this can lead to diabetes, and this can be associated with a lot of complications. So this can put you at high risk of heart problems, stroke, kidney problems. It can affect your vision as well and your sensation. This can also lower your immune system, hence making you more susceptible of catching infections such as the flu or a chest infection. So how can you prevent prediabetes developing into diabetes? The most important things are trying to lose weight. Losing any sort of weight is really, really beneficial, and it can make a difference. Losing weight can also lower your blood pressure and your cholesterol levels. Exercising regularly is also really, really important. Ideally, you should be doing at least 30 minutes of moderate physical activity at least 5 times a week. So moderate activity is brisk walking, riding a bike, also swimming, and also just making sure that you have a really healthy diet. So you can see there that on your screen the Eat Well plate, making sure that you eat the right portions, you eat a lot of fruit and green leafy vegetables. Good fruit are things like berries, strawberries, blueberries, raspberries, having a low-fat dairy diet as well, to try and minimize the amount of processed, fried and sugary foods that you eat, and making sure that you also drink a lot of water instead of sweetened drinks. Just to signpost you to this website, diabetes.co.uk. This is a really, really useful website in terms of top tips of preventing you becoming diabetic. And also, if you are a diabetic, this is also a really, really useful website. As you can see at the top, it's got tips on prevention, diagnosis. Also, I believe it has tips on really healthy and easy recipes that you can try at home. So that comes to the end of my webinar. I hope that was really, really useful. Please feel free to type in questions that you want to ask me, and I will try my best to answer them as best as I can.
Thank you, Rowena. We're just getting a few questions coming in now. So again, feel free to use either the Q&A box at the bottom or the chat screen. So we've got a question here. How often should we take the diabetes test?
Okay, thanks so much for your question. So ideally, this should be tested at least once a year. If we find that your sugar levels are not very well controlled, then we would on how well your sugar levels are controlled, but ideally at least once a year.
Thank you, Rowena. So does, if you are diabetic, does this make you high risk? I think this might be talking about the COVID-19 high risk categories at the moment.
Hi, thank you very much for your question. So, I mean, in terms of having diabetes, yes, potentially it can make you high risk of having the COVID-19. Because it can dampen your immune system, as I mentioned earlier.
Thank you. So I've got a question here. So I've been told as a pre-diabetic in 2019. Later, let's have a look. So I think this is somebody, again, regarding blood tests. They had a blood test in 2019, were told they're pre-diabetic and that their condition was okay. So again, how often they need to do the blood test again?
Okay, so if you have been told that you are pre-diabetic and after that it was good, then that means that you don't have to take another blood test until a year after your last blood test. So hopefully when this whole COVID-19 issue improves, we can hopefully do your blood test very soon if your blood test is due.
Thank you. Does alcohol increase risk of diabetes?
Really good question. And yes, it does increase your risk of getting diabetes because when you do consume alcohol, it does convert into sugar into your body. So it's really, really important to minimize your intake of alcohol, or making sure that you are drinking the correct amount and not overdoing it, as you do want to reduce your chances of getting diabetes.
Thank you. If both my parents have diabetes, am I going to get it for sure, even though I do my exercise and keep my weight under control?
Okay, really good question. So you've said that your mum and dad both have diabetes. It doesn't necessarily mean to say that you will 100% get diabetes, but you can potentially be at high risk. But as long as you are doing everything in order to reduce your risk of becoming diabetic, but it doesn't necessarily mean to say that you will become diabetic.
Thank you. I'm getting a few questions about blood tests. So just to clarify, we are only doing urgent blood tests at the moment. After the coronavirus, we'll contact everyone who is due for a blood test if you are high risk, and we'll let you know when we start them again. So I've got a question asking about how to keep active inside the home.
Okay, yeah, that's a really good question, because obviously the gyms are closed. I mean, active at home, you can, so for example, what I would say is if you're watching TV, you can jog on the spot, or if you've got stairs at home, you can run up and down the stairs. You can do quite a lot of things without going out or going to the gym. Yeah, so just jogging on the spot, doing star jumps on the spot, just anything that can get your heart racing.
Thank you. I've also got another question about if the practice is doing anything to help with diet and exercise. We are actually running a exercise session today at 2 o'clock, which you will be able to book on. So I'll send you the link on here to all attendees if you are interested. Okay, I've got another question. Consuming rice every day, does this increase in sugar level?
Yes, so it depends if it's white rice or brown rice. So a colleague of mine actually informed me of a really helpful tip, and she mentioned it, you know, things that are white can turn into sugar. So white rice, consuming every day, yes, can increase your sugar levels and can potentially put you at high risk. So I mean, looking at reducing your rice intake and portion control is also really, really important with rice. Definitely try to reduce the rice intake.
Thank you. Are there any fruit or veg that can help keep sugar levels down?
Yes, so fruits, I would definitely recommend berries. So strawberries, blueberries, raspberries, blackberries.
Thank you. I've got two similar questions. So if I'm high risk diabetic and have excellent control, does that mean I am no longer high risk of diabetes?
Okay, so it doesn't necessarily mean that you are no longer at high risk of diabetes, but if you have been told that you are at high risk and you have excellent control, definitely continue what you are doing. So whether that's eating healthily or continuing to lose weight and actively exercise regularly, to make sure that, you know, your risk of diabetes is not developing higher and higher. Oh, sorry, Sarah, I cannot hear you at the moment.
Sorry, I was on mute. I have borderline high HbA1c. Can I reverse this, or will it naturally go up as I get older?
Thanks for your question. So borderline high HbA1c, yes, you can reverse this with really good diet control, exercise, losing weight. You can completely reverse this. As you get older, yes, sometimes potentially it can go up, but if you if you concentrate on doing all those things that I've explained, so losing weight, healthy diet, physical exercise, this can be reversed.
Thank you, Irina. I've got someone asking if we can send some information, so diet charts for controlling high risk of diabetes, which I'm sure we can share. Also, if this session will be available, yes, we will add this session onto YouTube, so you can share it with other family members as well. Any last few questions from anyone? Okay, I've got a question. So I've been told as a pre-diabetic in 2019, I've been working out on the treadmill and playing badminton. I have reduced 8 kilos, but recently due to excessive exercise, I have got bad pain on my lower thigh. Will this have an impact?
Okay, so I'm really sorry to hear that you've been having really bad pain at the moment. Obviously, at this point, I wouldn't want you to overexert yourself and potentially worsen that pain. Obviously, give yourself time to rest, and hopefully the pain will subside in the next couple of days, and hopefully you will be able to continue gentle exercises at home. If you can't go back to badminton, that's okay. Just gentle exercises at home is absolutely fine.
Thank you. And the last question, do people with pre-diabetes have less metabolism?
Oh, that's a really, really good and interesting question. To be honest, I'm not 100% sure of the answer to your question, but I would like to actually find out and research about that question, and I will actually get back to you. Because I think that's a really good question for everyone to know. So let me get back to you. I do apologize, but I will research and let you know of the answer.
Thank you, everyone. So we're going to close off. You're just going to get a poll coming up on your screens just to give us a bit of feedback on how you found this webinar. So please leave your feedback. And again, this will be available on YouTube. You can share with your friends and family. And we'll send you some links of other webinars that we're running at the moment. Thank you all for joining.
Thank you.